primary health up the street, many of whom come from this end and find it difficult. So we're not sure, because we know that people will transfer down to this location. But we also know that people in the neighborhood have been coming in already asking when we're going to open.
Yeah.
And wanting pediatrics here.
Yeah.
So
Yeah. Wow.
I think that's a great thing.
Yeah.
So this is our partner.
Yeah.
Absolutely.
And who's got a huge building coming.
Yeah, we got to see yours.
Yeah.
Yes, yes, you have to come. We're not sure of the date right now.
Yeah.
But, you know, I'm like the optimist, so I say I'm still sticking with by the end of March. But the realist is saying maybe more like mid-April.
Wow.
Oh, that's
Pretty.
it is nice.
Beautiful. First time I've been here.
Oh yeah, let's go look at the exhibit. Oh, she's
This is great. It really is. So when are you actually opening?
Well, DPH gives us a
Oh,
license.
yeah, there you go. We were on the phone with Perlina today.
Oh, really?
We will open part of it on Monday, and a little bit more. We have one more license to get for the health center.
Yeah, that's awesome.
Hello, everybody. I just want to say I thank all of you for coming today. We are so thrilled that so many people turned out to help us christen this community resource. And we couldn't have done it without the help of many, many people. And one of the people that I want to start to say a few words is Jim Hunt, who is the head of the Massachusetts League of Community Health Centers. The Mass League has just been a force in the state and in this country, and Jim has been the leader behind that force. And this was renovated with stimulus dollars for community health centers, and Jim really pushed this through, and we would not be standing here today without Jim. So I'd like, Jim, for you to say a few words.
Thank you. Offer my congratulations and that of our 50 community health centers across Massachusetts and our now almost 1,200 community health centers across the country that stand with you today in this wonderful achievement. Secondly, let me congratulate Nancy Paul and the entire team of this health center for what you have done over time. Those 1,170 health centers serve almost 20 million people nationally, and we here in Massachusetts have grown our ranks to have 50 community health centers and almost 285 practice sites. It's an incredible tribute to the communities that have come together over time, as this one has in the long haul, and basically said, you know, with the community board, with an integrated system of care, we can provide better, respectful services to people within their communities, and we can work with our hospital partners, our physician partners, and our global partners, the state government and the federal government, to get the best care at the right price in the right place to the people who need it most. So having said that, we at the League, and I'm joined by Cheryl Shaughnessy, my membership director, Robin Curtis, my staff assistant and executive assistant, and Keith Maxwell, the iron behind the federal programs. We in Massachusetts are the leaders in the nation. We're the laboratory. Although we miss Senator Kennedy every day, if he were here, he would probably change his metaphor from health care for all to health for all. So part of that health for all equation is getting integrated care, and when Nancy first told us of this idea of using stimulus money, what we call the ARA money, to basically come together and bring together primary health care with behavioral health care and other services that people need, and to integrate that within the greater medical community of Fall River, we were just thrilled, because it is, as Nancy said, the first in Massachusetts of integration of behavioral health and primary health care working together. This has been really an incredible journey that continues for health centers in Massachusetts. But I wanted to be here to personally congratulate you and thank you for the opportunity, Nancy, and congratulations to all.
very briefly, I think Jim and I go back many years. We have seen healthcare just go through many changes. The one thing I do want to emphasize as well is the fact that this is not just an integration that makes some sense. This is use of money that is cost effective. This will save money in the long run because by integrating the approach, putting primary care, behavioral care, and substance abuse care all together, you're using your money more effectively, but the billions of dollars this costs our economy every year, where people are working through a very difficult time in their lives, is important. And these people will be back to work, their lives are going to be full again, their families will be together again, and so it's not just what it does to the individuals to give them the opportunity to go forward, it's also cost effective in the long run, and it's going to be something that Massachusetts is so far ahead with the leadership of people like Jim, who's been doing this for decades with these many issues that are all integrated into a terrific resource and treatment here. So congratulations on not just doing the right thing for individuals, but doing the right thing economically and the right thing for families.
I'd like our medical director, Dr. Holly Alexander, and those of you that don't know Star probably now know her through our commercials on TV. She's our commercial spokesperson, and Holly, do you want to say a few words?
Hi, thank you everyone for coming today. We are so incredibly excited that you are here joining us with the grand opening of this wonderful site. As you have heard, this really allows us to have integrated care, primary care, behavioral health, and substance abuse treatment all under one roof. And welcome and thanks for coming.
And I'd like Mayor Will Flanagan to say a few words. He has been a great supporter of STAR and on many different projects, and I think we really have been able to move forward with this project because of his support in our local community. Mayor.
Thank you.
Thank you very much. And when I was first elected, Nancy Paul and Senator Joe Menard came to see me in the mayor's office, and they asked me if I would support an initiative that they wanted to undertake here in the south end of Fall River. They wanted to take what they had working in the city's north end, primary care, preventative care, behavioral health, and locate that same type of facility here in our city's south end. And as stated earlier, STAR has been providing such a tremendous service to our community for so many years. And after hearing the proposal, I knew it was a proposal that I had to get behind because it was going to improve the quality of life for the citizens of our community. And this facility and its doctors and its social workers and its nurses is not going to act as a safety net, but it's going to act as a trampoline. And what I mean by that, the patients who come here, the clients who come here, are going to be able to rise back up in their own quality of life due to the treatment and service that they're going to receive here. And it's so great to be able to take a concept and an initiative that we talked about 2 years ago and be able to cut the ribbon on it today. And that just shows you the type of cooperation the city, the state, the federal government, working with our private sector and our nonprofits have improving the quality of life for the people here. So congratulations, and I know that this facility will benefit so many who come here to use it. Thank you.
We all know that prevention and support is just so important, and under your leadership and Nancy, and I just know that this is going to be a tremendous asset to the city. These folks who live here in Fall River now have access to great health care here in the South End as well, and I'm just really pleased to be here. Thank you.
I'm not going to put the music behind me, don't worry. But I do want to say thank you also, but I also, since I've been elected, have relied on STAR, calling on has constituents that have needs. And every time I call, every time Rep. Sullivan calls, every time the mayor calls, you are there for us and our people. So I want to personally say thank you to you, all the great workers you have in your staff, the directors, and this is only going to get better. So let's get a nice round of applause for Nancy. Thank you.
And I'm going to ask all of us to come close, and I'm going to give the mayor the scissors. But before I do, I want Dee Wright and Lisa Garcia, Pat Emslem up here. Dee Wright has worked day and night as There's Lisa. There she is. Pat Emslem's our COO. Come on up. We're telling you all from up there, and, but I'll put my hand on.
We'll do a ceremonial cut.
Yeah.
Ready?
Alcoholic drink. Eat, drink, and be merry. And if I haven't met you, I want to. So come on. Oh, W.B. Mason. Thank you, W.B. Mason, for this beautiful furniture.
You're in the right place, helping people. You're in the right place, helping people.